first of all, it's very hard to restrict glutamine in diet. You can't. It's glutamine. Glutamine is a non-essential amino acid, which means that it can be synthesized in the body.
Okay.
So there's no dietary restriction that will target glutamine. You really need certain drugs and procedures to do that.
Okay.
So glucose, of course, can easily be restricted, as you've just indicated.
Right.
And once you're in therapeutic ketosis, you can even use drugs to push glucose way down to very, very low levels. Maybe even insulin. We're working with that now.
Great.
But the advanced cases of cancer, you have to ask yourself, how did they get to be advanced in the first place? Were they always using metabolic therapy and now the cancer has finally reached an advanced stage? Or did they treat the person with all kinds of toxic things which didn't work, and now the patient is in advanced stage?
Yeah.
So I think you have to view these conditions separately, because sometimes the advanced cancer patient has already experienced multiple different toxic things, and the body is already pretty damaged from what they have gone through.
Yeah.
The person who never takes the damaging toxicities generally has more capability to fight the disease with various restrictions of diet and things like this. Not to say that the advanced cancer patient can't benefit from a more restrictive metabolic approach. The problem is that their bodies sometimes don't respond as the body of a person who was not treated with toxins. Yeah. So again, it depends on the individual as to how they might respond, because as you know, living your lifestyle, for a person who did not have that lifestyle and was all of a sudden going to try to enter into a zero carbohydrate diet, having been brutalized by radiation and chemo and all kinds of other things, it could be extremely difficult and represent a real hardship, as opposed to someone who's already in that lifestyle and their cancer is now progressing. What kind of drugs would you want to use to work synergistically with the diet and lifestyle that would work to manage the disease? That person should do better than the person who never had the lifestyle in the first place.
Yeah. So what would you do, doctor? What would you advise for people who suffer from advanced cases?
It's very hard, because you have to look at the person and say, okay, what have you already had? What are your symptoms? Are you still on drugs? Are you still receiving any treatment? What's your overall general state of health? Some of these people come, they're on steroid medications, they're on all kinds of other medications that will interfere and prevent metabolic therapy from working.
Yeah.
So, if you take them, for brain cancer patients, if you take them off steroids too quickly, they go into a coma.
Right.
So, many physicians need to know how to deal with these situations. I think you have to deal with it as a case-by-case basis.
Yeah.
You need to know, can a person in the late stage of cancer, can their body even enter therapeutic ketosis with low glucose and elevated ketones? How much of therapeutic ketosis can their body now get into? Some people no longer capable of getting into therapeutic ketosis, so they become a real difficult situation. So there's a lot of different things, and that's why you need a group session to discuss with people that know, and then plan a strategy for those kinds of people.
Yeah. Do you use glutamine inhibitors, like antagonist drugs?
Well, you can, but they're very hard to find. Some of them are not as powerful as others. Many clinics in the world do not know anything about targeting glutamine. Most physicians know nothing about targeting glutamine. Most oncologists know very little about targeting glutamine, which is strange, because the scientific literature has hundreds and hundreds of papers documenting the role of glutamine in cancer, and yet very few of the drugs that are treated cancer patients received, they don't target glutamine. So, maybe they don't do it directly, maybe indirectly, but it's not. So it's a very strange situation where you know what you need to do, but most people and their caregivers don't know that.
Yeah.
So it's a very awkward and difficult situation.
Okay, so when it comes to diet, I think we can limit like animal products and mushrooms, anything that can potentially contain glutamine or glutamates. So would that suffice?
No. It's not that. We're not really sure whether the glutamine that you have in your body is actually facilitating the growth of the tumor.
Yeah.
The glutamine that facilitates the growth of the tumor is present in the microenvironment.
Okay.
Also, our immune system cells need glutamine. So if you're going to clear dead cancer cells and you want to protect your body against bacterial infections, the normal cells of our immune system are heavily dependent on glutamine. So glutamine has to be dealt with very, very carefully because the normal cells need it, and so do the cancer cells. So you have to be able to strategically target the glutamine for the cancer cells while enhancing the glutamine for the normal cells. And this is a strategy that we are now working on.
Okay. So limiting sugar and carbs is easy, but like limiting glutamine is still like a field of research. Yeah?
Yeah, it's still a practical field. It's not insurmountable. It would be a hell of a lot easier than doing some of the other things. Yeah. It's just that very few, there's no good trials evaluating glutamine. And there's a lot of a different opinion about, whether, like in our strategy, we plan to target glutamine, but at the same time give large doses of glutamine back. So to help our normal immune system. Again, it's dosage, timing, and scheduling, which is cutting edge right now. Mm-hmm. And once we figure this out, we will share the information with oncologists, and they then must make their decision as to what they want to do.
Yeah, that's the sad part. They're not really cooperating with these therapies.
Yeah, well, they don't know about metabolic therapy, unfortunately.
Yeah.
So you have a massive industry with very, very few people that are trained.
Mm-hmm. Yeah. How do you deal, doctor, with the heavy detox that happens with therapeutic ketosis? You're burning fats, so a lot of toxins are coming out. So how do you deal with the detox?
Well, usually your body deals with it itself. The liver detoxifies the body. So you eliminate a lot of things in the urine. Your body can detox itself. As you go through therapeutic ketosis. But it's easy to say this. It's not sometimes easy to do. Mm. I mean, to really do a good therapeutic detox, you really have to stop eating for about 10 to 14 days. Just drink water, which is pretty severe for most people. And I don't care what culture, what religion, or what you have. You tell people they can't eat for 14 days, they're not going to be happy.
Yeah. I totally understand. Interestingly, I did notice that when I was going off sugar and carbs, I did notice that even if I eat a tiny bit of carbs, okay, the process would stop for 10 days. After 10 days, suddenly I'm back where I started. Yeah, so it's always like a 10-day cycle, or after the 10 days, things would go back to, I don't know, what we would call ketosis maybe, but my body would be fine living without sugar. But during these 10 days, it is hell. It's not easy.
Yeah, no. Did you measure your GKI, glucose ketone index? That's the key.
Yeah, I did measure my ketones using ketone stripes like in the past, but I didn't really do it meticulously.
No, you need to do it meticulously.
Yeah.
So you need to, for a cancer patient to know whether or not they're in therapeutic ketosis, they need to do a meticulous. You can get the glucose ketone meters now, either from Abbott Laboratory, or they have a new one called Keto Mojo, and there's a meter that will use blood measurements for both ketone and glucose, and there you can then calculate your GKI, and that allows people to know not only whether they get into ketosis, but the degree of ketosis that they're actually in. So it's a very quantitative measure of how long, and as a matter of fact. Like you said, with eating a little carbs, you might throw the glucose up a little bit, but it comes back down very, very quickly because you're a very high insulin sensitivity when you're in therapeutic ketosis.
Absolutely.
So, and your ketones generally don't go down so fast unless you're on a heavy carb diet. But generally, your GKI will only show a small shift, even though the blood sugar went up for a short period of time. The body is still making ketones. It's only when you persist with the carbs does the body begin to flush out all the ketones.
Okay. Doctor, I'm obviously a big fan of Otto Warburg's theory and his work. I've also spoken to the Italian doctor, Dr. Simoncini, who theorizes that a connection between yeast and cancer. And he actually goes as far as to say that cancer cells do not exist. It is just a fungus, and it behaves like a fungus. I know it's just it's like taking it to an extreme, but what do you think about the presence of yeast in cancer cases?
Well, I don't know what to say about that. A lot of cancers have been evaluated, and they are infected with viruses and mycoplasma and things like this.
Yeah.
Yeast has a different. When you talk about fungus and yeast, some of the yeast species are designed to live in hypoxic environments.
Okay.
But then they respire when oxygen becomes available. But cancer cells cannot do that. So they continue to ferment even though oxygen is present. So they're very different from a yeast metabolically. Yeast do not live permanently in hypoxic environments. So I'm not really sure what to say about that relationship because the organisms are fundamentally very different. Yeast are single unitary organisms where metazoan cells are not. So there's a lot of, I know, I've heard this speculation, but I cannot comment on that because I have no information. I know only that Otto Warburg's theory was correct, and we have now proven that. So, but other aspects of this I can't speak to.
Yeah, of course, there are a lot of kinds of yeast that can survive in the presence of oxygen. They would still ferment. They would continue fermenting.
I have not seen those. I don't know what kind of yeast species they are. Yeast, that's how they've discovered the Pasteur effect, based on yeast. Because when yeast will ferment in the absence of oxygen, but when oxygen comes into the environment, yeast now respire. They don't continue to ferment in the presence of oxygen, and that was the origin of the Pasteur effect. Whereas cancer cells are very different. They continue to ferment in oxygen. I don't know of any yeast cell that continues to ferment unless its respiration would be damaged, and I don't know about that.
Okay, so yeah, so you have you experimented with targeting the cancer cells directly, with direct intervention, as for example the Dr. Simoncini does that with alkaline solutions. Like he inserts catheters to where the cancer cells are, and he assumes that he's killing the yeast and the cancer cells consequently with alkaline solutions. So have you done any experiments of the sorts?
Well, we have metastatic cancers which spread all over the body, and we injected high dose of base. What is it? One of the sodium hydroxide, not sodium
bicarbonate.
But yeah, sodium bicarbonate. We injected a large amount of sodium bicarbonate. It had zero effect on the metastasis.
Really?
So yeah. So I mean, in our experimental system. Don't forget, the body is so the pH in the body is so tightly regulated. Any kind of a variation will cause massive physiological imbalances. Mm-hmm. So you have to be extremely careful when doing these kinds of experiments. But we tried it, based on the work of Gattenby and Gillies. They were arguing that there's an imbalance. But in our system, it didn't have any effect. As long as the glucose and glutamine are there, these cells are going to survive regardless of what most of these other things do. Of course, if you try to burn out the whole body with radiation or poisonous chemicals or something like this, you can kill a lot of tumor cells, but you also kill the body too.
Of course.
So I don't know what to say about the pH imbalances, because the body won't function properly if you disturb the pH balance, and that could give the cancer cell an opportunity to survive. I don't know. I don't work with that kind of stuff.
Yeah.
That's not going to be the real that's not going to be the real killer. The real killer is taking away the fermentable fuels. That's what destroys the tumor cells.
Dealing with the metabolism.
Yeah, the fermentation metabolism of the cancer cell. Without glucose and glutamine, they can't grow. Yeah. So the strategy for management becomes very clear. Mm-hmm. But most people aren't doing that because they think cancer is a genetic disease, and the evidence now is so overwhelming that it can't be a genetic disease.
Yeah.
So the people who still say it's a genetic disease are simply unfamiliar with the scientific literature.
Mm-hmm. The thing is, we're trying to find the best way to deal with literally advanced cases. We've seen people improve using these by changing the diet, of course, and we've seen people who try to change the diet, but the cancer still spreaded. So we're just trying to find the best way to deal with it. Like if we can.
Well, yeah, it's again. We published the press pulse therapy, which uses diets and drugs and procedures to work against the tumor cells.
Yeah.
And I think that's the future of cancer research. Once oncologists understand that it's a graded process, that you can destroy cancer cells in a slow graded way without causing too much disturbance in normal physiology. Mm-hmm. I think that's going to be the appropriate strategy in the future. I just think more and more people need to know about this. And as I said in our paper, we just outlined the procedures, that the actual details will have to be worked out for each individual patient. But at least you understand that there are several new approaches that can be used, and we need to be trying these things because basically they won't harm the patient as we begin to do this. So, like the new immunotherapies that are being used to treat cancer patients are every bit as dangerous as any of the previous therapies, and they may not work on a lot of people.
Right.
So, metabolic. I don't know anybody who has died acutely from metabolic therapy, but the literature is filled with people dying acutely from immunotherapy.
Yeah.
So, and from radiation and chemotherapy.
For sure.
So clearly, these are extremely toxic and potentially harmful therapies. And why would you do that to any human being if you know that the tumors simply need glucose and glutamine to survive? So why would you, subject anyone to anything that could possibly harm them? Mm-hmm. This just is a statement of a lack of knowledge on the part of the oncology community as to what the best strategies are. Yeah. Now, of course, if you don't know about metabolic therapy, then you will continue to use these very toxic therapies thinking that they might work. And in many cases, they do. Many people survive radiation and chemo and all this. But their body is damaged significantly, can be damaged significantly, putting them at risk for all kinds of other health issues, because they survive toxic therapy.
Yeah.
So metabolic therapy is designed to specifically target the tumor cells without harming the rest of the cells.
Yeah. Have you experimented, doctor, with weak oxidants in the management of cancer cells? I've experimented so much over the past 10 years with particularly two substances, chlorine dioxide and hypochlorous acid. And they do seem to be effective in some cases of cancer. And I did witness some people reverse their cancers with them.
Yeah, well, it might work. I haven't looked at it enough, but it's like intravenous vitamin C is a pro-oxidant that some people have benefited from. We're looking into hyperbaric oxygen therapy after the patient is first in therapeutic ketosis. This could be another non-toxic way to kill cancer cells, but the people have to be in therapeutic ketosis before they go into the oxygen chamber. So, and a lot of people, they'll jump into the hyperbaric oxygen without being in therapeutic ketosis. And I don't know what to say about that. I don't know if it's going to be helpful or harmful. Not harmful, but certainly not helpful. So it's hard to say. But, our press pulse strategy is that people should be in therapeutic ketosis before going into the hyperbaric chamber. I don't know what kind of diet would be best as long as they can get into therapeutic ketosis. So that might vary from one person to the next. So if they don't have the glucose ketone index monitor, they'll never know. So you really have to look at the monitor and say, okay, well, what you're reading now is good, or for another person, what you're reading now is not good. You better make adjustments, because what you do and what someone else does to get into therapeutic ketosis might be very different. So everybody should know. Without the meter, they can't really know. So because that's the biomarker to let people know. So if people are eating this and that and they're not in therapeutic ketosis, I would say don't eat that. It's not helping you. So even though they may have thought in advance that it was, there's a lot of things that you have to know about. But at least that's a quantitative biomarker to let people know if they're in therapeutic ketosis. And then they have evidence and say, listen, I'm in the zone. I'm in therapeutic ketosis, and here's my GKI value, and it's 1.0 or below, and I'll say, yeah, you're definitely in therapeutic ketosis. But without that information, it's all speculative. Nobody knows. It's hard to say, because on the one hand, the antioxidants are helpful for normal cells,
yeah,
and on the other hand, they protect cancer cells. So you've got to know the difference between the biology of the tumor cell and the biology of the body.
Yeah.
So the goal of our strategy is to lower glutathione in the tumor cells and elevate it in the normal cells.
Okay.
So that's why I'm saying you really have to understand the whole biology of the problem. And each patient then becomes a unique entity, and you do a lot of blood marker, biomarker analysis on each individual person and adjust that individual's diet and lifestyle to be in maximum state of therapeutic ketosis. And that can vary from one person to the next.
Yeah, it is very individual, although there are similar common factors, but it is individualized.
Yes.
Yeah, this is the case.
Right, there are common factors.
Yeah.
And that common factor is that in most cases, carbohydrates, it's hard to get into therapeutic ketosis when you're eating carbohydrates, a lot of carbohydrates. Yeah. And some carbs are low glycemic carbohydrates. So these are carbs that don't release a lot of glucose into the bloodstream. Other carbohydrates can be very high glycemic, and they should be avoided at all costs.
Of course.
But some of the low glycemic carbohydrates, like what you'd find in a grapefruit, they will provide the vitamin C without raising blood sugar. So there are very healthy low glycemic foods that have carbohydrates, but they're very low glycemic. Yeah. So they don't release the glucose into the bloodstream.
How about insulin potentiated therapies?
Well, we're working on that now. And again, you have to have individuals that are insulin sensitive as opposed to individuals that are insulin insensitive.
Okay.
So some people who have type 2 diabetes may not be appropriate for insulin potentiation until they become insulin sensitive.
Okay.
So you would need to work with that individual so that they would first become insulin sensitive before you would want to use insulin on that individual. Again, this is another area of active investigation. Okay. So we have to know whether or not an individual should be potentially a candidate for insulin potentiation therapy, or not. And that also depends on, again, what their state of physiology is before you begin the treatments.
Okay. So which substances would you use with therapy? Like, for example, sodium bicarbonates, would it work with insulin potentiated therapies?
I don't know. No, I don't think so. I don't know. I don't even want to say, because you can't know that unless you do the experiments.
Yeah.
Or someone else has done a very careful analysis that you can refer to. But the questions you're asking about sodium bicarbonate and insulin, I have no. We're starting the insulin experiments, but we don't do it with sodium bicarbonate.
Okay. Well, doctor, my time is up. So if you have anything else to add, and thank you so much for your time.
Oh, you're quite welcome.